Welcome, everyone. My name is Maria Aguilar, and I'm from the Chula Vista Public Library. Today, I want to welcome Adrian Carstans, who works on behalf of in San Diego.
We are a local nonprofit organization, and our mission is to connect people in our community with government, nonprofit, or other community-based resources. We're a 24-hour confidential free phone center and website, so people can contact us by phone or online, and we will look in our information systems to see if we can connect them with an agency that can assist with whatever challenges the client is facing. Our core is information and referral. If somebody calls us in that situation, we'll get an understanding of their needs and their potential eligibility, and then we'll look to connect them with service providers who will likely be able to provide the type of assistance needed. The most common reasons people call us are food resources, as well as utility discount programs or payment assistance programs, information about healthcare resources or types of housing assistance that may be available. In addition to that, we can also provide information and referrals for several other types of needs, such as transportation, legal matters, education, and employment.
So when a person calls 211 for assistance, what kind of information would the person need or would be asked?
Any information that's shared with us is voluntary, and people can choose to share as much or as little as they like. The type of information that we're going to ask for is typically minimum necessary to determine likely eligibility for different programs. For example, a lot of the programs we work with might be restricted to a certain type of client. So we need to know enough about the client to say, yes, you're likely a good match for this program, before sending them out to a service provider that may not be able to help them based on some of those eligibility criteria.
Now, if say someone calls 211 and wants to apply for HealthFresh, what used to be called food stamps, or housing, would they be able to apply by phone, telephone, or do they have to go to the website?
In most cases, we're not able to do an immediate application over the phone for programs. What we'll again typically do is try to get an understanding if the client is likely eligible, and then provide them with options on how they can apply. For example, CalFresh can apply online, by mail, in person, and in that case, we actually do offer an appointment-based service through our enrollment center, where the 211 operator can set an appointment for the client to receive a call back at a later time, and they would be able to help complete the CalFresh application or a CalFresh and Medi-Cal combo application. Our health navigation team is also available by appointment to help people complete Covered California applications. And so you can in fact self-schedule those online at our website, or by calling 211 and speaking to a representative who would be able to assist with scheduling that appointment. And then again, the enrollment center specialist or health navigator would call the person back at the appointment time to complete the application. Right now, there's a lot of interest in public benefits, and so our appointments are scheduled a few days out.
And with the COVID-19, could they get information like when the next, where they can get tested for COVID-19, for example? Would they be able to call 211 for that?
Absolutely, and we're working very closely with the county, in particular with the T3 program, which is testing, tracing, and treatment, which is under Health and Human Services Agency. They're working very hard to try to make testing in particular available to members of our community, and so we are partnered with them. We're getting information as soon as it's available, and so by calling 211, we would be able to tell you where there are same-day walk-up sites offering testing that don't require an appointment, as well as sites that are appointment-based through the county system. In addition to that, we have information about sites being offered by the state of California, other community-based organizations and healthcare providers locally here in San Diego, and even some commercial locations such as drugstores and laboratories and other medical clinics. We definitely want to make sure that the public knows that testing is available, and we can help you find a location that's convenient and accessible to you.
Now, what kind of services do you have for the elderly? Because I know a lot of them are homebound and they don't have the transportation to go somewhere. What are the most common resources do you have?
There are quite a few resources in our database that we could connect a client to. And eligibility can start in some cases at 50 and older, 55 and older, 60. So if somebody calls us, we'll make sure that we can match them with a service provider that meets their needs and their description. But the types of services provided really run the full spectrum, including transportation and food delivery, but also in-home support, help with activities of daily living, making sure that seniors are able to stay safely in their own homes and avoid having to look for secondary or rehousing. And in this era of COVID, when we've got seniors who are certainly considered a vulnerable population, we don't want them going out and taking unnecessary risks of exposure if we can at all avoid it. We've seen really, I think, inspiring cooperations between public and private entities and nonprofit organizations in our community to bring resources to seniors, especially in the domain of food delivery, but also just setting up ways to avoid the complications that can come from prolonged isolation, not having necessarily someone to talk to often enough, and providing those opportunities for even just little things like companionship that can make a big difference in terms of mental health. Yeah, so we are 24/7 bilingual, English and Spanish. We also have access to an interpreter service, so people are invited to call us regardless of what language they're comfortable using any time of day. We'll make ourselves available. And our website is, of course, up 24/7 as well. It's 211sandiego.org. And almost our entire database is searchable online. And so a lot of people prefer the self-service aspect of going to our website and performing their own searches. And the majority of the referrals that we would be able to give you over the phone are available through the website as well. Of course, our phone center is for those people who want that little bit of a guided tour, who want a bit of extra help understanding the difference between programs that may appear similar online, making sure that they've really considered the eligibility and the intake process and are selecting the resources that are going to be most likely to be able to help them. Either service is available 24 hours.
Is there anything else that you might want to add regarding 211 services or other information?
What I would want to tell people who maybe have never called us before, or maybe are considering calling us but don't know what to expect or if it'll be worth their time is, we're here to help. We are San Diegans. We're your neighbors. We want to be part of the solution for you. It doesn't matter how you came to be in San Diego. It doesn't matter how you came to be in the situation that you're in where you're reaching out for help. We want to, meet you where you are. We want to treat you with respect and dignity as a human being and as a community member. And we want to do everything that we can to try to help you. And we may even be able to suggest some services that you might not have thought of when you called, and surprise you with some of the things that we can do. So I invite you, I welcome you to please give us a try.
Well, thank you very much, Adrian. You have been doing a wonderful job for San Diego, and not only for San Diego, for Chula Vista also. And I really appreciated all your efforts throughout these years. And just remember, everyone, to wear your face mask and keep your distance 6 feet apart, and also wash your hands.
Absolutely.
Well, thank you very much, Adrian, for joining us.
Thank you, Maria.